Hi, everyone. My name is Lina Waughman. I am a genetic counseling student at Boston University's genetic counseling program. And I'm here to talk a little bit about the Capstone project I'm doing about the diagnostic and medical journey of someone with Janssen-De Vries syndrome. So I'll talk a little bit about what the study is about, and how you can participate if you're interested. A little bit about me. So I'm just about to start my second year at Boston University's genetic counseling program. I'm originally from Seattle, Washington, so I'm a West Coast girl. Um, and I'm really interested in working in either the pediatric field of genetic counseling or in a more rare disease research part of the field, which is a little bit of a smaller portion. Um, Outside of school or work, I love to read. I love cooking and knitting, and especially exploring as well, nature or anything in general. More importantly, a little bit about this project or about this study. Um, the goal of this project at its heart is to understand what experiences have been like for both someone with Janssen-De Vries and their family or caretakers when both getting the diagnosis and the following care that has either helped or maybe didn't help as much or was a little bit more challenging. So this might include information about whether or not genetic testing was a part of the diagnosis, kind of what therapies have been received and what was most helpful, and either challenges or something that was significantly um, changing during the either process. Um, there is no one size fit all path of care for each person, either with Janssen-De Vries or in general in the medical field. So hopefully, we hope that gathering this information regarding what families have done, either in the past or in the present, might help give either newly diagnosed families an idea where to start or families in general about different paths of care that people have taken. Um, so what parts of the study can you guys participate in? So there are two different parts of the study that we'll have. So the first is an anonymous survey, which will take about 15 to 20-ish minutes. And this will include questions about demographics, about the diagnostic journey, kind of like I was talking about, such as genetic testing, was a genetic counselor seen, things like that. And we'll also ask a couple of questions about kind of medical interventions, what medical professionals you're seeing, and what therapeutic supports might have been most helpful either previously or in the current time. Um, this survey is completely voluntary as well as anonymous, as each question is the same. So if there's a question that you don't feel comfortable answering, there's no requirement whatsoever to answer every single question. You can pick which ones you feel most comfortable answering, or if there's one that you're like, I don't know the answer to that, that's okay. Um, it's, like I said, completely anonymous, and any participation is really, really appreciated. Um, After participating in the survey, there is the option to provide your information for a further interview. This interview will be with me. Um, so it'll be very similar to the survey, but it'll be a little bit longer, so 45 minutes to an hour. Our goal is to interview about 10 to 15 people who have indicated that they're interested in being interviewed. We won't interview anyone who doesn't want to be interviewed. Um, and this will give us a chance to talk a little bit more in depth about information regarding what your loved one's personality is like, what was challenging about the diagnostic journey, what was most helpful, and then also what's most helpful now during their medical care, during their therapeutic care, and so forth. So this will give a chance to kind of expand further on stuff that was either mentioned in the survey, or if there's something that you think is really important within your experience, this is kind of the opportunity to provide that information. Once again, this interview is completely voluntary. If you feel comfortable participating in just the survey and not the interview, that's completely fine. If you feel like participating in both, that is also super welcomed. And during this, no personal information will be collected in the survey. So if people are interested in participating in an interview, there'll be a link within the survey to provide personal information in a separate survey. So it'll be completely separate from that anonymous survey that we just talked about. Once the interview is completed as well, all personal information will be destroyed and deleted, and no personal information will be included in the final project in the final study as well. So we're not keeping any information about you guys other than the experiences that you provide. So, what parts of this project can you participate in? Like I said, it's completely voluntary. You can also withdraw at any time. So, if you indicate you want to do a interview and then you decide, actually, no, that's not something I'm comfortable with, you're allowed to withdraw at any moment. And there are a couple of requirements. So, you preferably have to be above the age of 18. You do have to be English speaking. It doesn't have to be your primary language, but preferably someone who can speak English. And then also a loved one or a caregiver of a loved one with Janssen DeVries. So either providing ongoing care or current care. Um, and preferably, we would like only one entry for a caregiver or a person taking care of someone with Janssen DeVries per family. So one answer in the survey or one interview per one family, if that makes sense. Um, Information regarding the survey and how to participate will also be sent out shortly through the foundation. And also, if you have any questions, I will provide my contact information if anyone is interested in participating but has a couple of questions before doing that as well. Um, thank you so much for listening to my spiel today. Like I said, information regarding the survey will be provided soon. I appreciate your time just listening to me talk for a little bit about the project and for your consideration for participating. I look forward to hopefully hearing from some of you, and I hope the rest of the conference is wonderful and you get to learn a lot and meet lots of people. Um, Thank you to Kara and also the foundation in general for letting me be a part of the conference in this small way, and also for helping me a lot on this project. I don't know where I would be without Kara and the helps they've provided me. So I really appreciate everything, and thank you for your consideration for participating.